Moving on to another view of the heart, the apical view. So in the apical view, you're going to basically find the point of maximal impulse. As you can see in this patient, it might be in the fifth intercostal space, and close to about the midclavicular line is a good place to start. You're basically trying to put the probe right on the apex of the heart. And you can start with a 4-chamber view by pointing your probe marker directly off to the left, to the patient's left. This is with a cardiac probe, directly off to the patient's left. You get this nice view of 4 chambers, the right and left ventricles and the right and left atria, as well as the mitral and tricuspid valves.
This is the best view for looking at the size of the right ventricle. It should be smaller and less muscular than the left, about 1/3 of the heart to the left ventricle's 2/3. Bowing of the septum from the right ventricle toward the left in systole indicates high pressures in the right heart, often present in severe chronic or acute pulmonary hypertension, such as with hemodynamically significant pulmonary embolus. So these slides show the normal heart on the left, the very large right ventricle in the middle slide, and on the right you see the right atrium, which is also severely enlarged, usually another sign of pulmonary hypertension.
And taking a closer look, if we were to zoom in a little bit on the right ventricle and the right atrium, we can see the tricuspid valve a little closer. And this particular tricuspid valve, you'll notice, is longer and floppier than it should be, has some vegetation there. So this is another example of endocarditis, but here in the tricuspid valve, which is where you may see it in someone who uses IV drugs. So going back to our earlier thought that we saw in the peristernal short view of looking at the different territories of the coronary arteries, in the apical 4-chamber view, we can see some more of those territories of the coronary arteries. And so we can look at how well the walls are moving in that left ventricle and correlate that to coronary arteries. And we can also we can rotate our probe so that we can obtain another plane. So if you were to cut the heart into 3 different planes, you'd be able to see sort of the 3 dimensions of the heart, and would be able to assess all the different coronary arteries, the left anterior descending, the right coronary artery, and the circumflex. And so if you're in that apical view, and then you rotate your probe 90 degrees from the 4-chamber view, you get the 2-chamber view. And in the 2-chamber view, you're looking specifically at the left ventricle. So the probe marker now should be pointing towards the left armpit. And so you're able to see the inferior wall and the anterior wall of the left ventricle very well in this view. You can take note of how well each wall is moving.